Yep. Thanks, Ceann Corla, and thanks as well to the Minister. She's been here on more than a few occasions answering questions in relation to rare diseases, orphan drugs, and now this issue as well pertaining to the establishment of the Medicines Agency. And as the Minister is aware, this is a commitment that's been given in the programme for government, and we're here over 2 years into government, and I know that I'm probably going to guess the answer that maybe has been given to the Minister, but I think very little work has been done in this area, and I suppose the purpose of the question is to see exactly what has happened up to now in terms of delivering this agency. If the Minister could give any type of a time frame for the establishment of such an agency, because I know that she's well aware of the issues in this sector, particularly with the whole question of access to drugs for rare diseases. And I would like to first acknowledge the work that the Minister has done in this area up to now. Minister Donnelly has provided the largest budget over the last 2 years in terms of approval of new medicines, and that's to be welcomed. But I think I must also preface that commendation by saying that in this sphere the government has made very little progress, and I think we need to acknowledge that and be truthful about it. Also, it is welcome that the programme for government does allow for the establishment of the National Medicine Agency, but it is regrettable that the focus seems to be solely on lower pricing in terms of reimbursements. And obviously this is important, and the National Centre for Pharmacoeconomics already has this job and continues to conduct assessments of new medicines and getting the state bang for its buck. However, a National Medicine Agency needs to be more ambitious in my mind. It needs to take on the entire reimbursement system and making sure patients get quicker access to drugs that they require. It needs to ensure greater budget predictability. I mentioned that the Minister has supplied the largest budget in this space over the last 2 years, but at various times in the last decade no money was given over to the budget in this space, so greater budget predictability is a must. We also need to ensure greater patient involvement. The amount of patients groups I've met that complain about the lack of transparency in decision making for approval of these medicines, they don't feel involved in the process, and there's not very much interaction between them and the NCP. And we need to develop a specific pathway for orphan drugs, and at present no such pathway exists. I know Minister Abbott will be aware because she attended a cross-party grouping on Rare Disease Day on the 27th or 28th of February last, and I know that she's quite aware of the issues. So going forward, I think this agency needs to focus particularly on consulting with various stakeholders, patients, patient groups, clinicians, industry and health economists, because ultimately this is part of the wider picture in terms of rare disease and orphan drugs in particular. And as I've said here in the past, one of the hardest conversations I've ever had to have is sitting down with somebody face to face, and we make all the excuses in the world, but just some stats for the Minister, I know she's aware of them. In Ireland, the latest data from the European Federation of Pharmaceutical Industries ranks Ireland 24th out of 39 countries in terms of timely access to medicines for all diseases. The same report ranks Ireland 29th out of 39 for access to orphan drugs and 27th for oncology medicines. And the most galling thing about all this, and we've spoken about it, Minister, previously, all the large pharmaceutical companies that are providing these drugs worldwide are here on our doorstep. We're shipping these drugs to every corner of the planet and every corner of the continent, and we are one of the laggards when it comes to actually approving and getting reimbursement for those drugs. So I'd be interested to see if the Minister could give me an update in terms of the establishment of the agency.
Thank you, Deputy Minister. Thank you for being here.
Thank you, Ceann Corla. I wish to thank the Deputy for raising this issue today. And you are quite right when you say that the 2020 programme for government includes a commitment to establish a National Medicines Agency which will seek to reduce the cost of medicines for the state and for patients. As the Deputy is aware, the existing pricing and reimbursement process for medicines involves the work of a number of individual bodies and agencies, and the collective contributions of these agencies are crucial to the HSE Executive Management Team's decision making with respect to medicine reimbursement. Firstly, the HPRA, which is the Health Products Regulatory Authority, is responsible for the regulation of health products, including medicines, in Ireland, and maintains a register of authorised products. And under the Health Pricing and Supply of Medical Goods Act, reference pricing involves the setting of reimbursement price for a group of interchangeable medicines. This has enabled greater cost-effective dispensing and continues to contribute to cost avoidance. The HPRA's role under the 2013 Act includes the maintenance of a list of interchangeable medicines. This supports pharmacists to substitute medicines prescribed, provided that they have been designated as an interchangeable by the HPRA. The National Centre for Pharmacoeconomics advises the HSE in relation to the cost-effectiveness of new medicines. The National Centre for Pharmacoeconomics carries out health technology assessments in order to make recommendations, reimbursements to assist HSE decisions. The HSE's corporate pharmaceutical unit is an important interface between the HSE and the pharmaceutical industry in relation to application for reimbursement and the pricing of such medicines. The corporate pharmaceutical unit successfully commercially engagements with the pharmaceutical industry achieve significant savings for the state each year, thereby providing access to as many medicines as possible to as many patients as possible. The Deputy will be aware that in December 2021 the State agreed 2 new multi-annual agreements with the pharmaceutical industry, and it is estimated that these agreements will result in the State paying between 600 and 700 million less for medicines than it would otherwise. Since the finalisation of these agreements, the corporate pharmaceutical unit has been engaging extensively with industry to implement the agreed measures, and this has included the downward realignment of over 800 prices. The HSE's drug group is the national committee which makes recommendations to the HSE executive management team on the pricing and reimbursement of medicines. Such recommendations are based on the outputs of the entire assessment process. As part of this assessment process, the National Cancer Control Programme Technology Review Committee, established in 2011, review funding proposals for new cancer drugs. It then makes recommendations on the reimbursements of new drugs to the HSE drug group based on clinical and cost effectiveness. And in 2018, the Rare Disease Technology Review Committee was introduced by the HSE leadership with similar responsibility for reviewing proposals for funding of new drugs for rare diseases. The committee also contributes to the development and implementation of clinical guidelines for relevant drugs. The establishment of a national medicine agency would require a significant body of work to be undertaken in order to integrate all these various work streams under a single function, and it would also require extensive consultation and primary legislation. That work has yet to commence as the priority of the focus of the department has been tackling COVID up to this, and I'm acutely aware of the Deputy's involvement and knowledge in relation to rare drugs, and I feel sometimes when I read these answers I might know very little less than the Deputy who was asking the said question.
Yeah, Cormagut, Ara. I suppose, look, in the lengthy response, the real answer is in the last paragraph where it says a significant body of work needs to be undertaken and that it will require extensive consultation and primary legislation. And here we are halfway through the life of a government, and if we're talking about that substantive work, we really need to start. You know, that's the reality of it. If it needs to be legislated for, an extensive consultation needs to happen. We're talking here of a couple of years and we're halfway through the cycle of government, so I think we need to get real. I think that message needs to go back to the Department of Health that this needs to be instigated immediately. I meant to say in my opening remarks that, you know, I knew that COVID, because I have looked at other responses in regards to this question, and I knew that COVID would rear its head as an excuse at some stage, and surprise, surprise, there it is in the last line, but COVID didn't have an impact on some of the great announcements that the Minister himself has announced over the last few weeks in terms of women's health, for example. Nor did it have any impact on this week's announcement about the expansion of the HPV vaccine programme in schools. But when it comes to the issue of orphan drugs, COVID, you know, so I don't know how long. It's very frustrating to see COVID as an excuse in this area. And I think we need to, as I said, get real, and we're talking about people's lives, people's quality of lives. And those statistics that I roll out every now and again about Ireland being a laggard in European context, that should be a source of embarrassment to us nationally. But those statistics are used so often now, they just roll off the tongue, and they seem to matter very little. It's embarrassing that Ireland, you know, one of the largest pharma-producing nations in the world, ranks 24 out of 39 countries in Europe in terms of our provision of these drugs. It's embarrassing. And one last comment, Ciarán Comhairle, in relation to the HTA process, because obviously that's what the substance of my bill, which I'm trying to progress, is at committee stage. You know, we're using an antiquated, outdated system, and we're pretending that it's achieving all these savings, as you read out in your response, when the reality is Ireland spends a higher percentage in comparison to countries like Germany, Scotland, Sweden, you name it. We pay a higher percentage for the drugs that we claim through the reimbursement system than all those countries, and they supply the drugs up front. But we make patients wait a torturous 800 to 1,000 days. So I would argue with those statistics when I see that we're saving 700 or 800 million because we're such great negotiators. It's a load of codswallop, if you ask me.
Thank you, Deputy Minister. Follow that.
Thank you, Ciarán Comhairle, and I was happy to share my time with Deputy O'Sullivan to actually get in his last number of words there. So you are correct, Deputy, in what you have said. Like, to be honest with you, we have to move away from the fact of why we don't do this particular piece of work. There's no denying this, that it is in our programme for government works, and it is something I personally, myself as a minister, would like to see commence for all the right reasons that you have said, because first and foremost, at the end of the day, their orphan drugs make an awful difference to that individual's life. Secondly, what we all should be about is ensuring longevity within people's lives, but also the fact that we have access to those drugs here in this country. It actually makes it unbelievable. And would you believe it, as of the start of May, the 30 million budget that was allocated in Budget 2020 had enabled the HSE to approve 24 new medicines, and the HSE's robust assessment process and commercial engagement ensure that as many new medicines as possible made their way available to Irish patients. It just also shows that how quickly the budget was able to be accessed. I would love, within my Department of Disabilities, if my budget could be spent in June or July of the year, whereas in actual fact it shows the great need within orphan drugs and the great need within actually bringing more drugs on stream, that the benefit it has to the wider population on it. So I will take your remarks back to Minister Donnelly. He sends his apologies for not being able to be here this evening, so I will return your comments to him. Ciarán Comhairle, can I have your indulgence for 30 seconds, please?
Of course, Minister, I'm always happy to.
Well, as you know yourself, I spend a lot of time here on a Thursday evening.
And a lot of time other days as well.
Thank you, Ciarán. Can I welcome into the House this evening in the viewing gallery Bill O'Brien and Ming Chang O'Brien, who are accompanying my sister here this evening. They're here from the States and they're just calling in to have a chat this evening. So thank you for indulgence, and I'd just like to welcome into the House this evening. Thank you.
Thank you very much. Good to have our guests, your guests with us. Welcome, Minister McEntee. Can I just, with a view to being helpful to Deputy O'Sullivan and following on from the Minister's response, it would appear to me that targeted questions focusing on the final paragraph of the Minister's response, addressing the leadership and the progression and the timescales around the establishment of the National Medicine Agency could be very helpful to you.